Subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Amma ba'd. Nawaitu ta'alluma wa ta'dima wan naf'a wal intifa' wal ifadah wal istifadah wal hasanat 'ala tamassuki bi kitabillahi wa bi sunnati rasulih sallallahu alaihi wasallam wa ibtigha' wajhillah wa mardatihi wa qurbihi wa sawabih. Amma ba'd. Okay, last session, which was yesterday, we had a class on the introduction to the immunology and also hematology system. In today's class, we'll be talking about the laboratory management and safety. So the part one is mainly on the management, and part two will be on the safety. So this is the outline of the lecture. I will introduce to you how the lab is being organized, what are the scope of service, the lab flow, the types of errors, and some problem-solving strategies that have been put in place, introduction on QA, QI, and QC, and then principles of hematology lab, and then safety management. Okay. So laboratory service in a clinical setting like hospital or clinic covers various subdisciplines, which include biochemistry, pathology, hematology, immunology, blood bank, etc. And sometimes they are combined. They are put in one unit or a few of them together. Like pathology is commonly combined with hematology. Sometimes you find them in the hospital as separated individual unit. Hematology service in the hospital is commonly further separated into the blood hematology lab and the blood bank service. Sometimes they have different supervisors or directors. Sometimes they share the same management. So in the lab, this would differ from one place to another, but more or less this would be the main skeleton. You have the lab management, those in the management position. So biomedical science graduate is actually intended to become lab managers. Okay, you are intended to become lab managers. You are different from MLTs. MLTs are diploma holder, and they are intended to fill up the non-management positions. They are to be managed by degree holders, by biomedical scientists. Although there are it's not a problem if a biomedical scientist take up non-management position, jadi research assistant, jadi lab assistant. It's not a problem at all. But in terms of the management, position, the diploma holder, how to say this, it's not supposed to be put there lah. It's supposed to be those who are having a degree who are having a degree that should be at the management position. Okay, so that is the difference between MLT and biomedical science. Although when you do your internship, your clinical hospital placement, you may come across people or students from the MLT courses, and you might find that they learn basically almost similar subjects. Similar subjects. It's about the depth and the breadth of the subject, and also some additional subjects that they do not learn. That would differentiate between the biomedical students and the MLT diploma courses. The other thing is they may be very good at technical stuff. Yes, technical, practicalities. They are very good. With all the practicals, they are very good. But do not be how to say this, be or feel disadvantaged, yeah, because actually to master a technique is not difficult. It is mastering the theory. It is mastering the soft skills like problem solving. That part is actually difficult. It is taking the responsibility. That part is difficult. Techniques, you can, I think, a new technique, you need a willing heart. That is prerequisite lah. You need a willing heart, a heart that is willing to learn, a heart that is willing to be taught. Kena marah sikit-sikit pun tak apa, tak cepat koyak. Okay, that kind of heart. InsyaAllah, after 2 weeks, you will master that particular technique. So technique is not difficult. It's something that once you do, apa tu, Yana? When you do many times, yeah, it becomes natural. It becomes a habit. It's something that you will remember and you do it correctly. So, okay, let's go back to this structure. So we have the lab management. There are positions like laboratory medical director, and then this director may have under him a few managers managing different labs. Yeah, and then there might be department or technical supervisor, and then there might be chief or lead technical staff. Yeah, so those are the kind of position that would be available in the hospital or clinical setting. Blood bank director would be at the same position like the lab medical director. And then you have the laboratory staff. They are like medical technologists, medical lab technician, medical lab assistant, and then phlebotomist. Yeah. So phlebotomist in the UK during my time, there is a special or a specific position called phlebotomist. Of course, they need to have some knowledge on health sciences. Okay, they can be certificate holder, degree holder, diploma holder. Okay, as long as they have something that is related to healthcare. They can then take a special course with exam. Yeah, of course, the course is considered a professional course. It could be quite costly, mahal sikit, and they have to spend like a week learning about the phlebotomy. Yeah, it's from the vein sampling, arterial sampling, etc. They will cover that, and then at the end of the course, they need to take a exam, much like OSPI. There is also a written exam, and then they will be certified, and then they can work as phlebotomist. The position as phlebotomist is advertised, and they may be working in hospital, in clinic, in homes, yeah, in nurseries, old folks homes, hospices. Okay, they could work there. And medical students is special because any medical students who have completed their first 3 years of their degree, they are automatically deemed as being able to apply for the position of phlebotomist. So many of my friends, they work part-time. They work part-time as phlebotomist. So whenever they are needed, they will go to the hospices or to the hospital, and then they take blood. So it's quite a good pay job. Yeah. We do not have something like that yet in Malaysia. We don't even have a certified course. Yeah, there are courses being offered. I think IJN offers something. The blood bank center also, I've seen their advertisement. They are the private universities. They do this. They self-certified basically. Yeah, they self-certified. themselves. We can also do it if you want. Yeah, we provide the course, train people, they answer our question, and then we give them certification. Okay, whether the certification would be valid or not, or laku ke tidak ke, whether future employee will take you up or not, that's another matter lah. But here in Malaysia, the courses are more geared towards health professionals like nurses, doctors, who wants to revise and to relearn some techniques, or in cases like medical students from certain countries, yeah, macam Egypt, where they did not have enough experience doing phlebotomy during their medical degree. So they take up the courses just before they start serving. Uh, uh, okay, so sometime in the future, you may find a phlebotomist as a job, as a position that can be applied and regulated. Okay, I hope you still remember this chart, this flow chart yesterday, where I show you how things flow in the setting. Yeah. So firstly, we have the specimen collection, collected by the relevant personnel, and then being sent to the specimen reception. So many of you will be working and being the gatekeeper at the lab, yeah, at the reception. You need to check the samples and decide whether you need to reject or to accept. Yeah, there are criteria for rejecting, and there are also procedures to then request for a new specimen being collected. So the flow cycle includes the entire test, the entire steps, starting from ordering the test by medical personnel until reporting the results. Yeah, we divide the laboratory testing, the service, into 3 phases. Firstly, the pre-analytical. Yeah. Secondly, the analytical testing itself, and then the post-analytical phase. So the pre-analytical includes test ordering. So there are SOPs on how to order a particular lab test, how to collect specimen, and then also how to transport and process before it reach the lab. And then we have the analytical testing. Yeah, this is really in a lab setting. Most of the SOPs concerning the use of the machine, how the lab is managed, etc. We'll see some of it later on. And then post-analytical, yeah, which involve results transmission. How do we interpret the results? Kita run the test, sama ada dia blood smear ataupun multi-analyzer showing the full blood count, etc. How do we interpret those results? Are those results, at least at the laboratory level, you need to decide whether the results are reliable. Are the results could be accepted? Kalau nampak result ni lain macam, okay, what should you do? That is the interpretation part. And then results that are acceptable then will be transmitted to be we should relay back the results back to those that order it. So how do we do that? Okay, and then follow up and retesting. So there are cases where we need to reject a particular test, maybe because of the specimen. So to retest, there's a flow for it. Okay, this would be your close friends very soon. Yeah, the lab request form. You'll be looking at this and decide what test to do, to accept or not, etc. Yeah. So laboratory errors do occur. You can talk about this with Dr. Ibrahim, for example. I believe his PhD was on human factor in the hospital. the human factor, not machine, but the human factor. Why lab errors occur? His PhD is focusing on the human factor lah. Now, there are a lot of other reasons apart from the human factor, yeah, that could lead to errors. Okay, let's look. Let us look at what we have on the screen. Firstly, we have understaffing. Yeah, lab errors has been shown to correlate with understaffing, meaning that the less lab staff you have, you are more likely to get error. Do you remember during the COVID-19 vaccination, people were it went viral. Yeah, there were cases where people were injected with empty syringes, etc. That is the kind of errors, human errors, that could happen when the system is being overwhelmed. It's not that the person who are conducting the procedure is not well trained, not well paid, but maybe because understaffing. So it leads to fatigue, it leads to loss of focus, etc. Yeah. Inadequate attention to detail can be another reason. Okay. So that is why you are here and being trained to do things in the lab correctly and put attention to detail. Thirdly, lab errors can occur due to poor sample control, poor results verification. Poor result verification ni can be because you are really a careless person, or you are a very lazy person. You nampak result tak berapa okay, macam tak betul je. Maybe you need to check the machine, but you just couldn't care about it. Then you don't verify your results, and then you just transmit. So that could lead to lab errors. Quality control and assessment. So when we use the machines, as the machine process hundreds and thousands of samples, the error, machine error is increased. How do we then test? So there are QC and QA being implemented in the lab. So if we do not implement, we do not do this at the appointed time, it can again lead to lab errors. Maybe the lab is using non-validated tests. Non-validated tests could be something which is new. Bila buat bila ada COVID-19, diagnosis of COVID ni, kita nak pakai which particular kit, what particular sample. Nak pakai saliva, nak pakai sample from the nasopharyngeal, nak pakai from the oropharyngeal sample, macam mana? Okay, and then time pressures. Yeah, it is related to many other factors. When you are understaffed, there is a time pressure. When you have so many samples, you have time pressure. Yeah, and then poor workload management. Poor workload management is another matter, and biomedical or the lab supervisor, ini dia punya main responsibility to ensure that everyone in the lab has enough time to rest. Tak adalah seorang je banyak workload, dia seorang je kena process all the COVID-19 samples. Okay, yang orang lain tu duduk rehat sebab tak ada sampel lain masuk. Tak boleh macam tu. So you need to make sure everyone is equally treated. Kenapa ni Syakira ada remaining meeting time ni?
Tak tahu lah, doktor dia keluar, dia kata dia remaining meeting.
Ya, dia akan, so bila dia habis kita stop ke macam mana? Dan kita kena semua masuk semula ke?
Not sure, sebelum ni dia macam sambung sendiri.
Sambung kan? Okay. So we will see, kalau kita terputus kena invite semula lah kot.
Okay.
Okay, we just keep on keep our class, continue our class. So test results, there can be variations with our test results, errors, and then inferences. So the variations that are related to our test result are mainly due to clinical variations or analytical variations. Okay. Tadi kita cakap pasal error. Result-result yang kita dapat tu, it could be there is an error, there is due to variation, or there are inferences. Okay. So clinical variations are mainly factors from an individual or factors between individuals. And then analytical variations is because no test is perfect, is perfect. Masa COVID-19 tengah tu banyak orang yang because they do not understand, when we do testing, there is no perfect test, all tests that we develop, there is kita panggil julat atau average dia, dia punya accuracy dia between 90 to 95%, macam tu. We have to accept that no test is perfect, and our 90%, 95% acceptance level is considered acceptable. Takkan kita nak ambil test yang only 60% accurate. So satu test yang 90% accurate, I think is reasonable to be accepted. If we can fine tune until it gets to 95, 98, is also very good. But to get 100%, that is difficult. What is meant here is that when we test a person, he might get a negative result when he is positive. And likewise, he might get a negative result when he is positive. That is totally expected to happen. Sekali kita akan dapat result yang macam tu. This is because no test is perfect. All tests have some degree of variations for repeated measurement of the same sample, and sometimes just something that we could not explain. Okay, kenapa dia jadi macam tu? So the final test results is affected by factors that occur pre-analytically at the time of the test or after the test is completed, post-testing. So, right. So I want you to take a piece of paper. Okay, Shakira. Shakira pakai tudung ke tu? Okay, tak apa, no problem. Boleh je. Saya pun bawa balik daripada masjid pakai baju Melayu je. No problem. Okay, so you can take a piece of paper and a pencil or a pen, and then just brainstorm for a minute. Why analytical results vary? Think of it. Macam mana kita nak berfikir? Saya nak tengok awak berfikir secara sistematik. Bila awak dapat soalan yang macam tu, how do you systematically arrange your thought? Kat sini ada kan satu clinical variation and then analytical variation. So apa agaknya? Clinical variation ni contoh-contoh. Analytical variation contoh-contoh. You can also arrange it or think about it in this way. Pre-analytical, at the time of the test and after the test is completed, what kind of errors might happen? Saya ada cakap awal-awal tadi, some other things lah. Tengok balik. Kat sini kan ada test ordering, specimen collection. What do you think could happen? What errors? Why analytical results vary? Okay, Azam, do you want to share with us what have you written?
Yes, doctor.
Okay,
I think maybe the analytical result can vary due to human error.
okay. Can you be
And
more specific? Give example.
like maybe uh, there's contamination happen when the collection of specimen. I don't know.
Contamination. Okay, in what way? Bagi
Um,
example.
why? When in the lab maybe before.
Tadi cakap pasal specimen
Please.
collection. Let's focus
Uh,
on that. Don't worry, you are
okay.
in the right direction. Cuma please be more specific.
Maybe like example when they do the swab testing.
We are
But
talking about hematology. Okay, tak apalah.
oh, okay,
Swab
okay. I don't
testing.
know.
Okay, no problem, no problem. Let's follow your chain of thought. Okay. Now, what type of swab testing? Hello, Azhar kat situ ke? Okay, maybe
Yes,
something.
doctor.
Yeah. Okay.
Maybe due to there's many people that needs to be tested.
You were
That's
talking about
why
specimen collection and contamination just
uh,
now.
uh
Can we focus on that part?
yes. Maybe during the time of collection something happened like
What is that
I don't know.
something?
Um, the
Okay,
item used. Okay,
item use. Haizatul, you want to help Azhar? Haizatul ada kat mahalah ke tu? Tengah tidur ni. Shakira, who is your roommate?
My roommate ada dua, one Intan Raihana and Sahira.
Intan Rahana, you hear me?
Yes.
Yes,
Okay, can you
doctor.
see the screen?
Yes.
Okay. Banyak tu. Siapa yang cakap yes tu boleh jawab. Tak apa. So, siapa tadi? Lupa pula nama tadi. Apa ke nama dia?
Intan Raihana.
She mentioned about the yang trying to answer that my question just now. She mentioned about collection, specimen collection, problem during specimen collection. She was in the right direction. So analytical results could vary. Firstly, because of clinical variation. So clinical variation ada dua, inter-individual variation and intra-individual variation. So in terms of the inter-individual variation, it could be because of differences in the age. So imagine you are in the hospital, you are in the lab, you are running 100 of samples. Sebab hari itu ada 100 orang lebih patient datang hospital. So you're going to run. So the machine could accept 100 sample at a time. So when you put all 100 samples in from different individual, you then read the results. And you notice that the results are normal, but they vary. Macam semalam saya cakap apa, there are range kan for red blood cell, white blood cell, okay, and they vary, okay. If we do not have or we have not established what is normal, if we have not established the normal range, when you look at these results, 100 of them, with various variations, what do you think would occur? Won't the personnel become, I mean, confused? Yeah, should I accept this result or not? Okay, so there were variations which took place, and there were steps taken to establish the range. Ya, kita banyak sebenarnya, kita tahun 2021 ni dah macam dah settle banyak dah. If we were in 1970s, they were grappling with this kind of issue in terms of the variations. Yeah. So the variation could be because of age. Somebody who is a kid will have different result than those who are adult. And I mentioned about the normal range yesterday. Normal range in adults means that it is referring to those who are healthy and between 35 to 40 years of age. Yeah. Inter-individual variation also occur due to sex jantina, and then race, bangsa, genetics, so even between siblings, yeah, and also long-term health status. So if you look at people, some people, they have had some disease for very long time. So people with chronic kidney problem contohnya, they would appear with chronic anemia. Okay, chronic anemia is not because of the age, sex, race, or genetics, but because of the health status that has been affected. Intra-individual, kalau kita ambil satu orang saja, kita ambil Shakira lah. Kita ambil blood dia pukul masa dia tengah tidur, pukul 4 pagi. Cucuk, cap, kita ambil. Lepas tu dia dah bangun, dah buat aktiviti, pergi berenang ke, pergi berlari ke, and then we take another blood sample. And then lepas breakfast, take another blood sample, lepas lunch, lepas dinner, etc. So we look at her results throughout the day. We will see that there are variations, yeah, and these are due to diet, exercise, drugs that she take. Do you take drugs? I hope not, yeah. And then sleep pattern, posture. Posture. You remember when I showed you the picture yesterday, I said that this is a wrong posture. Yeah, the hand should not supposed to be hanging. And then the time of venipuncture and length of time tourniquet is applied. Yeah, tourniquet is the blue nak kata apa ya, tie. Yeah, something that we used to tie around the arm. Yeah, and then if it is too long, then we can have nak kata apa, inference to the results. Okay. And then we can also think of the variation in terms of the time, yeah, before, after, and during the test being taken. Tadi ada yang sebut pasal collection time, during collection ada contamination. So macam length of tourniquet ini, that one can introduce nak kata contamination. I mean there could be some exudates from the tissues that could be then entering the sample. Yeah. So some kind of lipids can also be introduced to the sample during the time of collection. Then transport, exposure to UV light, especially if we want to test for bilirubin, for example, the blood sample should not be exposed to UV light. Macam mana kita nak buat? Whether we put in a container or we wrap with a aluminium foil, so it won't be exposed to UV light, we can still detect the level of bilirubin. So this one is before it arrives at the lab, yeah, pre-analytical stage. Standing time before separation, centrifugation time, and storage condition. So this relate to the type of test that we want to do, pre-analytical variation. And then when we are during the time of testing, We call this analytical variation. The variation could arise from random errors. Macam tadilah, unexplained. Suddenly there is one which is giving us totally different results. Yeah, or it can be systematic errors, like after 100,000 of samples, then the machine loses its accuracy, and we need to recalibrate. Itu systematic errors. Dia akan berlaku selepas some time, selepas berapa ratus sampel. I'm sure some of you are driving, and some of you are aware that some time your father has to send the car for service. Kan? Ini sebab ni lah, because all machines, they need to be sort of recalibrated, sort of being serviced. So that's we need to change parts, or we need to change we need to recalibrate something, yeah, so that they become accurate and will not produce errors or any unwanted effects. Lastly, we have the post-analytical errors. Okay, semua dah okay, transportation okay, specimen collection okay, machine has just been recalibrated, but errors could still happen because of things like transcription errors. Transcription errors in the past, especially, people have to write down what is the results. Okay, these days we key in. So still, when we key in using our laptop, our computer system, we can be typing something which is totally wrong. Ya, macam kita WhatsApp apa semua, very frequently student WhatsApp to me with lots of typos. Betul tak? These days, kadang-kadang tu tak tahulah typo ke tak. Dia nak cakap nak, dia sebut NK. NK ni apa benda? Not known ke? Apa, I do not know. Sometimes I don't understand. I have to write back to the student, say, what do you actually want? Can you write in a proper manner? Can you spell? I wonder if the person can spell. Yeah, they are doing degree, but sometimes they appear as if they do not know how to spell. I am very worried when they get into job. Yeah, bila dia nak buat ni, transcription errors will occur. Apa yang sebenarnya dia nak tulis? I do not know. Yeah. Okay, that's correct, right? The remark is correct, right? So saya selalu cakap kat student saya, you come to university, we want you to become ilmuwan, somebody who has ilmu, somebody who is knowledgeable. Appear, at least kalau kita tak betul-betul jadi ilmuwan pun, we appear as someone who has knowledge. And one of the marks of someone who has knowledge is the language that he use. So spelling contohnya, takkan nak spell like student Tadika, kan? So even when you write to each other, you write to your lecturers, write properly, use proper language, use proper spelling. Okay. Kalau tidak dia jadi habit, and then ni ada banyak transcription errors. Result reported to wrong patient. Okay. The result is correct, but because of the system error, etc., you send it for different patient. Yeah. Saya tak tahu nak bagi contoh. Orang Malaysia ni selalunya nama memang unik. Ya, macam-macam nama dia. Macam apa, Shasha Syafiqah. Dia punya combination tu susah orang nak jumpa same combination. Ya. Affendi Shafri pun susah juga nak jumpa Affendi Shafri. Affendi banyak, Affendi Shafri susah nak dapat combination tu. Tapi kalau dekat UK, A. Smith, Alexander Smith, ramai Alexander Smith. Ya? Ramai Alexander Smith. Christopher Green, punya ramai Christopher Green. So there is a higher chance for them to make error. Christopher Green yang mana ni? Macam tu Okay, now pre-analytical errors. Tadi cakap pasal collection. These are the questions you need to ask when we do the collection. Was the right tube used? Was venipuncture performed correctly? Was the specimen properly stored? And this is why the reason why you have a specific class on phlebotomy, and why we have a specific phlebotomy session. Yeah. Identification, was the blood collected from the correct patient? A Smith yang mana? C Green yang mana? Yeah. So they introduce a specific code, apa registration number, etc. To identify the patient. Kalau saya nak tahu anything regarding my mom who is under the care of Institut Jantung Negara contohnya, they will not want to know the full name. They will not want me to spell out the name, yeah? But they will immediately ask for the MKN pula apa M apa kena nombor tu, MRN number, MRN number, registration number, so they ask for that number only. Sometimes saya bagi nombor salah juga, dah dapat nama orang lain. Okay, identification. Was the blood correctly labeled? Yeah. So apa yang kena ada pada any blood specimen? Kena ada patient name, and then ID, date, time of collection, and the phlebotomist initial. So like Nur Shakira. Nur Shakira, what is your father's name?
Muhammad Ansor.
Muhammad
Ansor.
Ansor. Okay, so your initial would be something like NSMA. Okay, that one is your initial. Mine would be MAMS. Okay, so the lab tahulah. In case I have someone in the lab also MAMS, the lab people they have to create another initial for me lah. So when you initial, you do not have to put your whole name. Malaysian kan nama punya ada panjang, Muhammad Affendi bin Muhammad Syafri, panjang nak tulis. So just put MAMS. MA mesti banyak. MA tak boleh. MA mesti banyak. Okay. NS like Nur Shakira, dia mesti banyak NS. Sometimes kita go up to 4 letters. Okay. One of the common sources of erroneous lab result is misidentified specimen. So we require everyone to clearly write the names, yeah? And we set up rational policy for identifying specimen and handling misidentified specimens. Okay. Interferences could happen due to abnormal physiological change, okay, hemolysis, etc. So those are some of the reasons why errors happen. Okay, I think at this stage we all agree errors could happen. Yeah, many factors could lead to it. So what has been done by human community worldwide? Okay, to solve the problem. Yeah. So we are talking about the history now. So firstly, what they did was they created agencies. Initially, it was at the national level of that particular country, and then they go up and they have an international conference. So they harmonize. We call it harmonization of the units. Dulu orang Melayu pakai apa? Hasta, ruas. Okay, orang Inggeris akan pakai inches, pounds. Okay, the French will be using meters, centimeters, kilogram. So if I'm a Malaysian, I go to UK, I got checked there, and they gave me results, certain results in inches. Then I go to France, the doctors there ask me, what is the results? Then I give in inches. He won't be able to understand directly, abruptly. Dia kena tukar. So there could be more errors happening. So that's why we then come up with something that can harmonize all these different systems. So there were joint committee on accreditation of healthcare organization, Centers for Disease Control, Division of Laboratory System, CDC still there, yeah. And then we have International Organization for Standardization. I'm sure you have heard of ISO, ISO this and ISO that. Okay, so that is another very important agency. We also have a Malaysian Society for Quality in Health, yeah, our own national agency. Tapi jarang nak dengar lah. Yang biasa dengar ISO. We have Institute of Medicine, UK ada, US ada, kita pun ada Agency for Healthcare Research and Quality. And then Institute for Healthcare Improvement, Institute for Quality in Laboratory Medicine, International Society for Quality in Healthcare, National Committee for Medical Lab Quality System. All sorts of agencies have been created to solve those kind of problems. Yeah? Ada yang part SOP for human, ada part SOP for the procedure, ada part for the reagents. Nak pakai apa ni? Nak test for anemia, nak check for hemoglobin, sebenarnya ada banyak protokol. But which one would we want to use so that it becomes standardized? So that wherever this person, Muhammad Affendi, go anywhere in the world, kan, semua orang tahu apa dia punya result. Dia pun nak cerita senang. Macam tu. Okay. Then we identify stakeholders. Okay, stakeholders ni people that are relevant, and we have to think whenever we do a policy, we have to think who will be affected. Okay, the public, healthcare providers, those that develop the standards, the reagent, the suppliers. So we have to find which reagent is less costly, most effective, not very damaging to the environment. The QA providers, do we have quality assessors around? Those that can give a certificate or recognizing agencies ni, are they there? So kalau tak ada, semua ni kena adakan. Okay. Okay. Then finally, creating a workable work system. Everyone can create agency. Everyone can sort of think of the stakeholders and then suka-suki menetapkan SOP. But will the SOP be able to work? That's the next question. Ya, ke dia ni suka sendiri je kan, ataupun very idealistic kind of SOP. So this is why we have consensus standards of national or international origin. There are a lot of meetings that have been done. And then the policy must be declared and clear. So in the lab, it should be there on the wall. Quality monitoring should be there. So kita monitor, bila kita buat satu SOP, we monitor over 1 month, over 3 months. Is there anything that is challenging to implement the SOP? Is there something that we can do to improve it? Something to add or something to extract out, yeah? Improve tracking of outcomes. Okay, we do this as healthcare provider, we do all this step, good for us, but is it good? Is it convenient for our patient? If you go to the hospital, they always have that smiley and then you then rate, and but we want to see, because they are also stakeholder, we want to see whether they, apa ni dia panggil, satisfaction tu. Adakah kita punya sistem ni work for us but not working for them. Dia orang terpaksa tunggu lama. I give you an example. My mom has to underwent heart surgery. Bila heart surgery, they have to fast her. Dia kena puasa. Okay. So she was admitted the day before at 2 PM. Tapi dia punya scheduled surgery dia at 4 PM the next day. By midnight, she was told to fast by midnight. Okay, sebab dia kena berpuasa sebelum masuk surgery, memang kena puasa. And then sebab dia kira sepatutnya 8 jam sebelum operation kena puasa. The thing is, dia kira semua patient yang the next day tu semua kena puasa pada pukul 12.30 malam, mulai pukul 12.30 malam. Regardless of whether their surgery time is 8 in the morning, 10 in the morning, 1 o'clock or 4, like in the case of my mom. Okay? Sebabnya dia nak senangkan kerja orang-orang di hospital tu. Tapi dia tidak menyenangkan the patient. So Do they have some kind of feedback system? No, they don't. I have no way to complain. Yeah. Will they take up money? Tak ada. I may have to write to the hospital director explaining and suggesting what could be done. Kita kat mana ni? Improve tracking of outcome, improve awareness of client satisfaction. They never ask me. They never ask my mom. Bukan senang nak berpuasa lama-lama for a elderly. Now, establish quality system for biomedical laboratories. This is just like a history for you lah. So we have CLSI, and then International Organization of Standardization, the ISO. They first produced in 2000 quality ISO 9001 2000 quality management, 15189 in 2003 on medical laboratories. So if you look at the years, not too long time ago lah, all these were being produced, yeah, and they keep on updating. Yang saya tunjuk ni just history lah, mana-mana yang terawal, but you will find a new one. Always there are the new one. Okay. ISO 17025 1999 on the general requirements for the competence of testing and calibration laboratories. So there are lab that do testing and calibrate, and they need to be certified juga. Okay, so when we go to the hospital, we see all these people, okay, all these machines. Sebenarnya they have underwent a very stringent procedures, stringent protocols before they are being allowed to serve us. Yeah, but of course there are still places where I think we can improve on. Okay, ni kat US, the move towards quality management, the serious move actually started with the US military when they wanted to develop requirements for contractors for their arms, yeah, their senjata. So they want their senjata, their arms to be accurate. So they started to have protocols for their contractors, how the shell should be, how the aircraft should be. Okay, and they want, dia punya aim adalah they will get quality material even if they do not do any inspection, because things has been in place macam ni. That is their aim. Sama lah kita pun harap-harapnya kita nak capai satu keadaan yang ideal where we have all these policies, we assume that everyone will follow. Even kalau kita tak buat audit pun, actually the accuracy, the efficiency would reach 100%. Okay. So from the US military ni, dia berjangkit kepada other type of industries. Everyone wants their machine to be tip-top, and then they form the International Organization for Standardization, ISO. Okay, then adalah Department of Defense, etc. You will learn about MILQ 9858, the Australian, British, Canada, America standard. So 4 countries get together and they standardize. Initially, it's all for military purposes. Okay, and then they develop established British Standards Institute in 1979. This one start for civilian use. Okay. Then ISO modifies and adopts BC 5750 for international international civilian. They start to become introduced to other countries, etc., etc. Okay, sampailah kita dapat sekarang ni. All this, if you become auditor, maybe 2-3% of you will not work in lab, but you become auditors for lab. Okay, that's another position that you can look into if you like being auditors. I don't like auditing people. I don't like the stress of the job. I don't like to remember all the tiny nitty-gritty details of things like number ini untuk apa semua. I don't like. But if you like, that's another position for you. Okay. Okay, so they work, all of this work together at the end. Yeah, mula-mula it was established for different purposes by different stakeholders. They provide their own guidelines, etc. But then they see the need to work together. So everything in the world is good if they become harmonized. Yeah, so sekarang ni kita ada ni yang ada kita pakai ISO ni lah. Dah tak ada dah ILAC and CCLS. Okay. Okay. So the ISO family of QM standards. Yeah. So quality management ni, okay, places like SASMAC, I believe this year or last year they received the ISO for quality management for SASMAC. Maknanya bila dapat tu dia orang dah melalui prosesnya lah, proses banyaklah proses ya. So it involves the general ISO for industry in the case of SASMAC hospital, and then their labs, how they do testing, calibration, how they produce their results, and whether these days also the ISO standard has also included environmental ISO. Okay. So all these fall under the QC and QI, yeah, quality control and quality improvement. This should be clearly defined and well organized before kita dapat ISO tu semua ni kena ada. So QI program must provide the system design and evaluation of proper patient identification and preparation, specimen collection, preservation, transportation, storage before testing, processing, and how results are being reported. So SASMAC contoh dia nak dapat ISO tu, dia kena implement quality control, kena implement quality improvement. Okay, maknanya kalau dia ada QC tu, QC tu sendiri kena being ready, being prepared to be improvised, to have channel for improvement. Then only the ISO people will allow the certification. Okay. Okay, so how do we do the QI, QA quality improvement, quality assessment? Judgment of the acceptability of quality control data must be made at least monthly by the lab director or its deputies or designee. Yeah, this is of particular concern to many of you who become lab directors lah. Because of many variables, there is currently no specific recommendation on the frequency of any additional assessment or review of QC data. Okay. There must be evidence of active review of records of instrument function, temperature, and maintenance for all routine procedures on all shifts. These are under the responsibility of the directors. Lab must have documented system in operation to detect and correct significant clerical and analytical errors. One common method is review of results by a qualified person before release from the lab, but there is no requirement for supervisory review of all reported data. So it's up to the lab themselves, yeah, to have the timetable, the schedule to do the QI and QA. Okay. QI supervision. So system must provide for timely correction of errors before results become available for clinical decision making. In the absence of on-site supervisor, the results of tests performed must be reviewed by the lab director, general supervisor, or person in charge of the chemistry lab on the next routine working shift. So these are all in general. Okay, so that is how the lab is being managed. Yeah. So understanding that there are errors, errors cannot be totally eliminated, but we can do a lot of things. Yeah, a lot of things to reduce it, to minimize errors. And we have SOPs. The SOPs that are currently in place is not an overnight work. Okay, has been there for many years. Many agencies have been involved. It's also the certification process, etc. is not easy to get. It's stringent. the labs are expected to adhere to certain processes. It will be greatly irresponsible, not to not to to follow the standards. Kalau kita tak nak go for standard pun tak apa, no problem. You don't have to be certified. Tapi getting a certification is very good lah, to show our commitment. Okay. Any questions so far? Kenapa kita asyik ada time ni? Ada siapa-siapa ada soalan? Apa dah?
Doktor.
Ya.
Okay, saya Farhana. Jadi maksudnya before untuk dapatkan certification tu, the hospital itself tu, the lab tu sendiri dah jalankan benda tu. And untuk dapatkan certification tu, macam mana nak being recognized tu? Macam tak dapat tadi.
Yeah, they have to apply. They have to apply to the to the authority lah. Macam kalau nak NIOSH contohnya is one of the agencies that will give the certification. So we apply. We tell them that we want to get this. So they will ask for documentation. Ada tak kita punya system, the SOPs. So please submit to us. And then what is your evidence of training schedule contohnya. Kita kena provide. Dia lengthy lah, dia akan check every single part. Some labs at Kuliah of Medicine, they are also ISO certified. Lab CAS belum certified lah.
Jadi apa disadvantage kalau tak dapat certificate tu, being certified tu?
Okay.
Ke tak ada pun?
Dia macam mana biar kalau kita dalam industri and have an ISO certification kan, dia macam halal certification. Kalau awak ada satu produk, you do not have halal certification, what is the likelihood of your customer buying your product? Dia tak semestinya orang takkan beli langsung, tapi kalau orang macam saya tak tengok tak ada halal certificate, saya tak akan beli. Jadi dia reduce your possibility to sell the product. So macam COM dulu dia nak provide certain services to the hospitals, to outsiders. So without ISO, mungkin less likely for them to get customers. Okay, macam hospital, bila dia dapat ISO, they can go to companies like Petronas and say that, look, our healthcare offering is very good. Petronas will ask, what is the evidence? Oh, our lab is certified. Okay, our lab is also syariah compliance. Petronas tanya, apa contoh you punya syariah compliance? And then we have this certification of syariah compliance from JAKIM. This is blah 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 blah. Our food all halal certified. We have kiblah, etc. So itulah bila nak it helps you. Dia kalau awak tak ada, tak apa, tak ada masalah. But it will reduce the possibility of you getting contract, getting funds. Okay.
Okay, terima kasih doktor.
Okay, kalau tak kita boleh meneruskan. Sekarang dah pukul 3.35, dah sejam. You want to have a break or not? Take a break 5 minutes break. Move around, okay. Ni pun dah nak habis ni. So kita stop kat sini. Nanti Syakira invite us again. Okay.
Boleh
can now see your application. Maksud dia. Right. Can you see the screen? Part 2.
Yes.
So part 2 ni quite dry, I must say, and maybe you have had something similar. So we be quick and kalau tak habis pun tak apa. I have like another 60 slides. So it's the general lab safety. Why does lab safety matter? Because safe working will protect you, other lab workers, even the cleaners that come to the lab, visitors, we never know, rector may come, also your own work, protecting it from contamination. So always need to be safe. What does the law say? We have laws, we have agencies that want us to work in a safe manner. Yesterday's one worker was had an accident, a fatal accident at factory. Entah dia kena apa macam elektrik ke apa ke, mati so very sad if someone is mati, die during working when it is supposed to be safe. So OSH, they have implemented environmental acts which include control of substances hazardous to health. And the lab must perform risk assessment. Okay, the OSH will come. Our kuliah also, we have our own OSH committee. They will come and do risk assessment at the labs, on frequent basis. Even places like My Ulam, do you know we have My Ulam? Akila tahu ada My Ulam? Ada. Okay, Farhana tahu we have My Gaharu. Okay, even those gardens, because they are projects, they are term projects of the kuliah, the OSH people come and assess, they check, even daripada satu pokok nak ke semak tu, dia kena 5 meter away, kena clear, contohnya lah. Because the idea is whenever we are in our gardens, like the gaharu, we must be away from the semak because the semak contain maybe snake. So kalau we cut the grasses 5 meters away, we have no, the risk of getting bitten by a snake is less. Okay, risk assessment, determine hazards and also evaluate risk. Use all relevant available data. So that's how we do our risk assessment. Determine controls needed to minimize those risks. Farhana, you don't have to take note and just listen. Okay, semua nanti saya bagi ni. Also, the risk assessment will involve document also, documentation. This documentation is everything. Okay, and it must agree with the supervisor or the one who do the auditing. Yeah. And then use control measures. Control measures. Susah benar nak sebut hari ni. Okay, use a less risky substance. These are the way we try to minimize hazards in our setting in the lab lah, in this particular case. Use a safer form of that substance. We use solution instead of powder contohnya. Okay, sometimes powder dia lagi cheaper, but there is a higher risk. Okay, control measures also means that we, why tak keluar? Hold on, there's a distraction. Okay, so using the using glove box, okay, using fume hood or fume cupboard, okay, these are all control measures that we implement in the lab. Kalau terbakar ke apa dalam tu, all the asap, the vapors may be hazardous. So we have ventilation that will take it away from us. So we are not exposing the whole body. Only the needed part only is being put in the cupboard. Okay. We must have also safe systems of work, reduce exposure time, increase distance, reduce volumes, and wear PPE, personal protective equipment. Okay. So wear the clothing and protective wear as identified in the risk assessment. Adakah gambar ini menggambarkan seseorang yang akan lulus dalam risk assessment? Tak, kenapa?
Rambut panjang.
Perempuan ramai yang rambut panjang, kenapa lelaki tak boleh? Lelaki kalau rambut panjang je tak boleh. Perempuan rambut panjang semua orang.
Kepala tak tutup.
Apa takkan lelaki nak pakai tudung?
Macam cap tu.
Macam pakai cap. Okay, it depends. Kalau if you are working in the lab like apa hematology lab, it is actually acceptable lah sebab dia ikat dia punya rambut. Tak perlu sangat pakai tudung pula dia tak perlu pakai cap. Cap tu hanya macam very ni macam apa if you are working in the pharmaceutical plant, very sensitive lah kalau ada sikit pun ni very sensitive. Okay, of food, food, tu memang perempuan pun dia kena tutup juga atas tu. Okay, tapi kalau lelaki bukan setakat kena pakai cap tu, janggut pun dia kena pakai cover. Macam kalau saya masuk the ICOP punya pharmaceutical plant, dia ada satu lagi, janggut pun dia kena cover because all these hairs dalam environment macam tu dia kena tutup. Tapi kalau lab biasa, hospital lab, research lab, they need to tie dia long hair. Okay, lab coats must be kept fastened. No sandals or open shoes. Okay, no sandals or open shoes. Even myself when I go to the lab, maybe you see me around the campus, wearing sandals, Tapi in the lab, yes, I will change. Memang kena. Long hair must be tied back. Okay, personal protection glove. There are many different types of protective glove available, and as part of the risk assessment, OSH, macam-macam lagi act yang lain lah. Okay, if you use the correct one, you'll be agreeing to those act and SOPs. So basically, just use the right one. Yeah, you will conform to many requirements. So it is about the definition of the correct ones ni. Itulah yang memerlukan pentafsiran. What is correct for you? What is correct for that job? Okay, some jobs like if you are doing smear, if you use a very thick glove, it won't help. It will not help. Yeah, you need a thinner one. And then you need to remove your glove before using instrument, telephone, and before leaving the laboratory. Jangan rasa you ada pakai glove tu, you rasa macam hebat bila keluar daripada lab. Likewise, I don't actually encourage people wearing their lab coats outside the labs. Awak rasa macam, even the medical student pun, if they leave the hospital, they should take off the lab coats sebenarnya, their white coats. So it just reducing a lot of risk. Hospital is not the most sterile. Okay, it's not the most sterile. Lab as well. Lab as well. It's not the most sterile. You are playing around with lot of samples. Okay, samples blood tu may have HIV, hepatitis, etc. It's not clean basically. So and when you do not know, you just splash some blood onto the coat that you are not aware of. If you become a habit that you wear your lab coat to cafes, it will make people uncomfortable. It will introduce infection, etc. Okay. So laboratory hygiene. Okay. Never eat, drink, or smoke in a laboratory. I'm sure none of you are a student smoke. Yeah. But they may eat and drink. Um, I kind of a bit lenient on this part. If you want to drink, you make sure that the drink is being put in the bag. Macam bila awak nak minum, cepat-cepat apa ni, masuk balik dalam bag and plain water only. Never put your water apa ni container onto the lab bench. Saya kat situ saya ni sikit, mungkin orang lain masuk pun tak boleh. But I'm lenient with regards to the plain water. Macam juga library lah. Masa kat UK dulu, library kat universiti saya, dia boleh bawa masuk air minum. Tapi mesti bertutup dalam gelas, tak boleh cup. And must be plain water, and when you drink, you put back into your bag. Itu. Never apply cosmetics in the lab. Okay, never apply cosmetics. Some lab, they may not want you to wear contact lens even, because depends on the procedure, because sometimes mungkin takut cair ke apa dalam mata, something happen because you are using solvent, etc. Also sometimes saya pun pernah pakai contact lens, sometimes it becomes very dry kan, kita buat prosedur lama-lama very dry, and then dia macam terkeluar tau, dia on its own sebab dia dah jadi very dry, and then that basically bila it happens, we are being distracted, and that can lead to other things lah. Never touch face, mouth or eyes. Okay, so we wear protection over them. Never suck pens or chew pencils. Okay, only kids do this. Of course, all of you still have kids in you, but not in the lab lah. Do it elsewhere. Okay. Okay, always wash hands before leaving the lab, and especially before eating. Good habit ya. Awak rasa awak sterile macam mana pun, okay, bila awak nak keluar lab tu dah pakai hand sanitizer semua dah, tapi before eating you mesti wash your hand again, yeah, because you do not know what is on your hand, what have you touched in the lab. Yes, our lab at the degree undergraduate level ni, you tak ada pakai apa-apa yang very infectious, but we would like you to get this as your habit from now, yeah, so that dia tak jadi habit when you are working. So saya pernah tengok even orang yang orang kata dah graduate lah, bila dia nak keluar lab tu, dia basuh dia punya tangan dengan hand sanitizer, lepas tu pergi kafe, dia terus makan, tak basuh tangan. Lepas tu saya tanyalah, kenapa dia tak basuh tangan? Dia kata, my hands are already very sterile, I use hand sanitizer, dia kata. Aduh, tak tahu lah nak kata macam mana, but it's not a good lab practice. Okay, general hazard in the lab. What hazard can you find? Fahana very happy ni. Awak pernah buat ke Fahana? Pakai hand sanitizer sebelum makan. Oh. Okay. General hazards could be fire, breakage of glassware, okay, sharps, spillages, pressure equipment and gas cylinders. Okay, with regard to fire ni, lab kita pernah terbakar. Nak cakapnya. Tak tahu kenapa dekat dalam lab, research lab tingkat 4. Okay, dekat situ ada cell culture, maybe because we have nitrogen liquid tank, we have oxygen tank, carbon dioxide tank, semua kat situ. Maybe some of the tanks leak, ya, dan kita tak perasan. Itu sebab kita kena sentiasa buat check, ya, monthly or weekly even. So nobody realized, then in the middle of the night, yeah, somebody call the dean and said that it's on fire. What's the consequences of that? Some students, including mine, tak boleh nak buat kerja. My student, for example, dia drop from her master's course, terus tak jadi buat master's. Okay. Anything else? Extreme heat and cold, chemical hazards, biological hazards. radiation. So quite a lot hazards in the lab. Not the safest place on earth. Okay. So avoiding fires. How do we avoid fires? With regard to flammable substances, we use at minimum install in special storage cabinet that must be fireproof if possible. Use temperature control heating sources. Okay. Okay. And then minimize fire damage by keeping doors and fire door shut. Sebab tu kita suruh bila duduk dalam lab tu semua tutup pintu. Bukan jangan biar terbuka. Okay. Okay, glassware. Use correct technique for insertion of tubing onto glassware. Dia ada cara kita nak masuk dalam benda, ikut, follow that instruction. Okay. Never use glassware under pressure or vacuum unless it is designed for the job, because it can break easily. Dispose of cheap or broken glassware properly. There are containers for that. Yeah, we call it sharp bins. Could be yellow, could be red, depends on the lab. But never put it in any other bins, not the general waste bin. Yeah, bukan bin yang warna biru ke apa ke. Okay, spillages. Ni blood yang spillage in terms of blood, if you are in the hematology lab, or any other reagents, yeah, chemical reagents, dye, apa ni, pewarna, pencelup. So we'll be using pencelup dye ni juga in our hematology lab when we want to stain. So awak tengok nanti our benches more or less clean lah, because we practice this. Bila spill je kita lap quickly, kita tak tunggu dry. Bila dia dry nanti awak punya bench tu awak tengok dia jadi peta dunia. And we don't want that. So it must be clean. So clear up spillage promptly. Dispose any hazardous material as toxic waste. Remember, messy workers are usually poor workers. We don't want any UIA student to be labeled as poor workers. Yeah, nanti kita ajarlah how to work in a systematic manner, appear to be a very clean person. Yeah. Okay, this is gas cylinders. Yeah, all labs will have gas cylinders. All labs that have cell culture lab, that have microbe labs. Yeah. Basically all lab lah. Saya tak boleh nak think of any lab that do not have gas cylinders in them. Yeah, they have to be used with formal training, and we want to minimize the number in the lab. They need to be stored externally, keluar daripada lab tu. Macam dinding. So kalau boleh kat luar, tapi make sure that kat luar tu dia taklah somewhere where usually there are people. Yeah, somewhere. Perhaps even in the cage. So cylinders are heavy and can do serious damage. They must be chained when in use, and when we want to move them with cylinder trolley. I'm telling you now because you will be the supervisors in the future. Yeah. So benda simple, but you have to be told. Use regulators and control equipment suitable for the gas concern, and consider the consequences if cylinder leaks. If you are the student using it, you must report to us. We have cases where students, they take things for granted. They saw a snake in an animal house. Dia nampak ada snake tu, dia buat kerja dia je, cepat-cepat siapkan, and then just left the animal house without telling anyone. Okay. And then another person, ladies, came in, almost got bitten by the snake. Yeah. Lepas tu baru nak cerita, oh saya dah tengok dah tadi. Tak naklah macam tu. Very selfish. Yeah. So if you bau apa-apa ke, dengar apa-apa ke, maybe it's leak, then you need to alert people. Yeah. Cryogenics. Sometimes in the hematology lab, some of the blood samples, we need to put them in cryo tubes, or keep them frozen, yeah, under very low temperature. So liquid gases are extremely cold and can cause burns, and we have to use gloves, thick gloves to handle. Yang macam ni, what do you think, Mas Turina? What do you think of the picture?
extremely cold.
What?
It's
Tak dengar. You're talking but I couldn't hear.
extremely
Sorry, tak dengar lah Pastorina. Okay. Hanis Patini. What do you think of the picture?
Some serious damage.
Tak dengar.
Some serious damage.
Some serious damage. Kenapa awak rasa dia damage?
Um, mm, sebab dia nampak macam tak simpan dengan clean kan. Dia ada macam putih-putih tu.
Putih-putih tu sebab dia very cold. All those white things are ice. Pernah tengok ke -80 freezer?
Pernah.
Pernah? -80 -80 bukan freezer dekat rumah.
Okay,
Mesti
tak
kat
pernah.
luar.
Tak pernah.
Tak pernah. Freezer ni -80. -80. Itu hari masa COVID-19 vaksin tu dia nak bawa ke Malaysia yang Pfizer tu kan jadi isu sebab dia kena masuk dalam -80 container. So very low temperature. Okay. Sebab dia nak preserve some of the materials. So if I look at this picture, okay, ni menunjukkan kepada saya satu freezer yang tidak manage well. Itu je saya cakap Sebab apa? Sebab freezer yang manage well, dia tak akan biarkan ice tu develop kat tepi-tepi ni contohnya. Ini contoh maknanya freezer ni pernah ditutup tak rapat. Mungkin lock dia rosak ke apa ke ataupun orang normally student lah dia tutup tak rapat. Dia tak jaga betul-betul. So dia develop all this ice. Bila ice tu develop, dia getah tu lagi akan tak rapat and then jadi rosak tu menyebabkan ni build up semua ni jadi because of that. Okay. Keduanya kalau tengok sampel ni, some bottles, some containers are of different shape and different size. Maybe different color as well. So some kind of management, tak tahulah mungkin ni okey sahaja, mungkin tidak. Okay. Tapi nampak sekali imbas macam tidak well managed lah. Okay, tak apa. Ini nak tunjuk awak berapa ni lah. The point here is that there are samples that will be kept under cryogenic. We use cryogenic. We need to use liquid gases. They are extremely cold. Ini extremely cold tau. And when you touch them, you can get burned. So you need to wear gloves. Otherwise, you get burned because of the cold. Liquid gases evaporate and many can cause asphyxiation. Lemas. Jadi kan kita suruh lab kita tutup tingkap, tutup pintu sebab kita tak nak kebakaran. Tapi kalau orang tak jaga dia punya fridge and there are leakage of gases, boleh terbakar juga. And in this case maybe they become lemas because of the gases. Okay. If there is a need to take cryogens in the lift, there are special procedures to follow, etc. Okay, electrical equipment. Again, electrical equipment, once we had centrifuge yang meletup dalam lab. Okay, because somebody put materials yang tak sepatutnya, tak jaga calibration, etc. Dia meletup, dia panas. Okay, so we always do a visual check on electrical equipment before use, looking for obvious wear or defects. They must have safety check sticker, e.g. by SIRIM. Okay, never use defective equipment. So this is a challenge these days because people like to buy things over the online, from Shopee, from Lazada. They give you nice discount, free shipping vouchers, etc. And you can buy directly from China, and then these equipments are not checked. We don't really allow people to bring other equipments into the lab, ya. Tapi I must say lah, I also bring in benda macam radio. Masa tengah nak buat kerja tu, bawa radio, some kind of portable devices ke, because we want to listen to something. Apa? So benda ni semua kadang-kadang ada risiko lah. Ada risiko. General tidiness. Siapa punya meja macam ni? Siapa nak mengaku meja dia macam ni? Actually, this kind of table shows that the person is very hardworking. If you want to look at it in the positive way lah, very hardworking people. People who are very tidy. Ini sebenarnya dia tak buat apa-apa ni. Okay. Tak adalah. We always need to be tidy as well as hardworking. We want both qualities, tidy and also hardworking. Not hardworking tapi very bad macam ni. So we need to clear up waste, deal with washing up and put things away as you finish with them. Okay, I want you to do this when you are in the lab. Make sure everything is safe before leaving things unattended. Okay, even if you think I'm just going away for 30 minutes for coffee, make sure things are safe. A tidy laboratory avoids accident to everyone. Remember, yang masuk bukan setakat you, not only your friends, but also people like cleaners, very innocent people. They may not know what this and that are for. They may touch it ke apa tak tahu. So yang macam kita nak buang waste tu. How many of you when they have breakage in the house, you will take the breakage bottle contohnya and wrap with many layers of surat khabar, newspaper, and then you will make a few layers of bag plastic before you put it in the bin. Who among you will put benda ni maybe at the side of the bin outside your house, indicating that it is something different. Tapi letak tepi tu bukan letak tepi saja, letak dalam box apa ke, sebab takut orang terpijak. How many of you are taking all these measures? Okay, now you need to do this not only in the lab but also at home. Okay, so people who are the cleaners yang kerja alam flora semua, they also will be exposed to this kind of hazards. Okay, lab equipment. Never use any lab equipment until having received training and have been authorized to do so. Okay, first aid, you need to know some first aid. If you have opportunity to do first aid, to take first aid training, please take it. Very useful to attend to chemical splashes, bleeding, etc. Most importantly, any accident must be reported to supervisor, safety officer. Okay. Waste material. Part of the risk assessment will be to determine how to dispose waste lab material safely. Not to dispose saja, tapi safely. Solvent and oils must be segregated into the correct drum. Chemicals or biological materials will be disposed of according to SOP. Do not put materials down the drain or in normal waste unless authorized to do so. Not directly into the drain. There must be some SOPs on how to dispose of. So maybe in our lab taklah, but when you are working or when you are doing your research. Okay. These are some of the different type of bins available. It may be different from places to places. Contoh macam shark bin ni ada setengah tempat dia warna kuning. But the shape is like this lah, more or less. Ada setengah panjang melonjong, ada setengah horizontally longish, ada setengah very small. But whatever it is, you will recognize by the shape and also by the color. Each place will have some kind of color code for each bins, indicating the type of waste, biomedical waste that you need to put into them. Okay. Any questions so far? 37 minit. Okay. Before we become interrupted again. What happened? Shakira punya factor ke ni? Okay, Nabhan, are you here?
Yes, Doctor.
Yeah, good.
Yeah.
Alhamdulillah. Okay, just checking on you. Okay, everything okay, Nabhan?
Alhamdulillah, okay, Doctor. Alhamdulillah.
Okay. If you have any problem understanding or listening to this, any question, burning question you want to ask, please do so. Yeah, I don't feel shy. Okay.
Okay.
Hematology lab safety. Let's continue. Okay, potential dangers in hematology lab. What are the potential dangers? It could be biological. Kita pakai blood. We be using blood samples. Chemical hazards, because there are reagents that we use. Some of them are toxic. So we use in small quantity. Electrical hazards because we are using equipment, and fire hazards. This is true to any kind of labs. Biological hazards, it is an occupational hazard that many lab workers encounter daily and present in various sources throughout the lab, like blood and body fluids, culture specimens, body tissue and cadavers, lab animals, and other infected workers. They may also present with biological hazards. In a typical clinical lab, workers may be exposed to geographically prevalent and common pathogens in the community. In a research hematology lab, the level of risk increases exponentially. Kalau katalah ada case HIV, so the risk would be higher. Betul, kalau dalam certain research topic, they may be focusing on a particular disease. Okay, the most virulent or the most dangerous pathogen could be exposed to the people in the lab. Okay, pathogens, the common ones, are like HBV, hepatitis B, hepatitis C, HIV, Ebola, okay, avian flu, fungi, SARS. Blood is the most important tissue in the body. Even though all samples must be considered infectious, the blood ranks among the most infectious. That's why risiko dalam hematology lab is considered high. If you look at HIV, blood has higher concentration than any other body samples from a person infected with HIV. Okay. So preventive measures for biological hazards is basically the same kind of things that I have mentioned. We must use proper PPE, and then must undergo appropriate training, must know the SOPs, must have access to reading materials like safety guidance documents. SOPs must be there in the lab and must be followed strictly. Be there tu maksudnya dia kena ada dekat dalam lab tu, dekat dinding dalam lab. Okay. Prophylaxis vaccine must be given against HBV and TB, and they must be given free of charge. Macam korang nak masuk dalam biomedical course, you have to take vaccine ni kan, or you have to prove that you have had immunity against them, right? Betul tak Akilah?
Yes.
Ingat ke 2 tahun lepas you need to show evidence of having immunity against Hep B. Some institution they may want you to test again and before you start working with them, and then boleh ambil sekali lagi vaksin tu. Okay. Sekarang memang kena bayar sendiri. Kalau katalah somehow tak ada immune kepada HBV, you need to pay for yourself. But when you are working, it's the responsibility of the employer to provide it for free. Okay. Preventive measures also include lab hygiene, being organized and being safe. Practice or procedures appropriate to the worker skill should not be told to operate something in which they have no training in. Okay. In the case of an event that happened, like injury due to needle stick, yeah. So appropriate medical treatment should be given and transmission risk being reduced. Maybe bagi prophylactic treatment for them, but those that are involved in the injury must inform their officer, yeah, as soon as possible. Okay. With regard to the samples, infectious samples must be labeled infectious. Okay, and safe decontamination and disposal of biological waste material should be done. We must use safety cabinets and be cautious when using sharp objects like needles when possible. Never remove, recap, band, break, or clip used needles from disposable syringes. Yeah, the other safety precautions with regards to the needles. Yeah, needles in the lab ataupun any sharp lah in the lab should be pointing downwards instead of forward. Ya, nanti bila kita buat phlebotomy lab nanti kita akan tengok the habits of every single one of you. Okay, I need to stop here because it is going to Zoom will be off anytime soon. Nanti saya invite semula resume. Okay. Okay, other preventive measures for biological hazards. Utilize appropriate method of wearing and removing gloves. This one I will demonstrate. Yeah, kita bukan buang terus ya. There's a way so that you don't touch your skin using the glove. Okay, and then use mechanical pipetting devices. Lab must have emergency plan ready for any kind of accidents. Chemical hazards. In hematology lab, chemicals utilized are dangerous and can cause things like burns. Hydrochloride can cause this. Blindness, okay, like methanol can cause blindness if you happen to mistaken them for beverage. Yeah, very rare, but it does happen. Others include bleach and also formaldehyde. Okay. So we need to label all chemical properly, never use unlabeled materials, and never guess what the material is. A good lab practice must name, write down the concentration, the preparation date, etc. Okay, everything here. And it is a good practice. Masa zaman saya dulu, tak tahulah, tapi masa saya degree dulu, dia tak being emphasized much on the MSDS. It was only when I was doing my masters that people start talking about the MSDS, material safety data sheet. So whenever we want to use a material, we put in our lab logbook what material we use and the MSDS. Masa degree, all this is assumed to be covered by your lecturer or your lab assistant. Tapi masa masters, masa PhD, and when you are working, is your own responsibility. Okay. So chemical hazard, any flammables must be stored properly in a storage cabinet, distance of 2 meters away from any heat source. Any working solution must be stored in the working bench for not more than 2 days. Okay, so working solution maknanya kita nak buat satu eksperimen, kita tak boleh buat sikit-sikit. Okay, so normally we will prepare in a huge quantity. That is our working solution. So then ideally the lab must have its own working bench. So any working solution, we put it there. Bila kita nak pakai, kita ambil sikit, kita bawa to our bench. Okay, but if we prepare the solution, we should not use them if they are already 2 days and over. Do not store chemicals that could create reaction together in case there are leakage that we do not know. Okay. Work in a well-ventilated areas and proper PPE. Dah berapa kali dah sebut proper PPE. Ya. Safety showers, eye drainage or washing corners must be built to address acid and alkaline chemical spill. Perasan tak dalam kita punya lab ada benda ni? Ada shower kat sebelah depan, belah kanan. Procedures to be performed must be posted as stickers or written as document, and do not carry chemical vials without proper container. Okay. Okay, itu chemicals, biological chemicals, and then now we come to the flammable hazard. Again, safety showers, etc. Do not carry vials. Kenapa macam sama ni? Do not wear contact lens. Chemical hazard, flammable hazard. Do not wear contact lens while handling chemicals. And then electrical hazards could occur if plug-ins for cables is not built properly, faulty socket and cables, or you handle things with wet hands, or use low quality machine, or if there is unstable currents. Okay, fire hazard could start due to chemical or electrical interaction. And important to utilize flames in a safe setting. Lab must be well ventilated, no smoking. Some chemicals are explosive even in vapor states, and they need to store properly. Okay. These days we follow OSHA, which provide us with the standard for the precaution, how to handle the occupational hazard. And then they give specific emphasis on how to hand wash. Ada cara nak wash our hands actually. How to handle needle puncture and how to handle certain sample in hematology. Okay, let us look at hand washing. Yeah, one of the most important safety practices. It is protective against chemicals, protective against irritants, and as well as infectious diseases. So hand washing actually best using soap and water. Hand sanitizer tu not best sebenarnya. Many reasons lah. One of it is if you use hand sanitizers, some of the hand sanitizers that are available on market may not be according to standard. Okay, awak boleh check hand sanitizer. Mungkin awak pun ada juga dalam bag masing-masing. You buy the commercially available hand sanitizers. It is only good, only effective when the alcohol content is more than 70% or at least 60%. Yeah, dia punya medical grade more than 70%. But kalau awak tak nak beli yang medical grade, at least 60%. Okay. Some of the hand sanitizers being produced, especially due to the COVID-19, orang nak dapat duit cepat, they only have 10% alcohol, 20% alcohol. That is not effective at all. The thing is, when it is 70%, sometimes it will kill all the natural flora, good bacteria, dia akan kills. So not, itu yang tak bagus gitu. So if you use soap and water, that actually already enough to get rid of many biological organisms. And then after we clean, we must thoroughly dry our hands. Yeah, proper technique, wet hands and wrists thoroughly. Kita kena wet dulu sebelum letak sabun tu. Jangan letak sabun masa tangan sedang kering. Okay. Apply the soap and rub hands vigorously for at least 15 seconds. If you notice, even in hospitals these days, dia dah lah bagi hand sanitizer tu coet, just one tu, macam masjid tadi, masjid UIA, dia sembuh sikit sangat, nak rub macam mana kan? So actually there must be a certain quantity. So if it is very small amount, if we want to rub for 15 to 20 seconds pun tak sempat, because the hand sanitizer have a lot of alcohol. It will vaporize. Within 5 seconds dah habis. So it defeat the purpose. This is what happened at the mosque just now. In hospital also, I've seen that happen. People just press once, so it's not enough. So you need to have enough amount and enough time for the hand washing. This is the technique. Yeah, you must first wet your hand and then put the soap. Running water tu enough lah, taklah terlampau besar, tak terlampau kecil. And then rinse. Okay, and then dry using a tissue. And then using the same tissue, then you turn off the tap. Jangan pegang dengan tangan yang sudah bersih. And then you touch the tap, your hand becomes unclean again. Perasan tak ni? Okay, so especially kalau kat kafe kan, kadang-kadang tak ada tisu kat situ tu. So apa saya buat, selalunya saya akan basuh sikit kepala pipe tu. Sebelum saya basuh tangan saya dengan sabun, saya basuh dah siap-siap. Bila saya dah selesai basuh tangan saya, tak ada tisu, tak apalah, saya boleh touch the tap. But this is actually another thing that you can do. You close the tap using the tissue. Okay. Hand washing. Hands must be washed whenever there is visible contamination with blood or bodily fluids after completion of work. Whether your hands is dry, tak ada touch apa-apa semua, tapi after you complete the work, you just wash. After gloves are removed and between glove change, before leaving the lab, before and after eating, drinking, smoking, not that I recommend, but if you are a smoker, before smoking pun you must wash, before and after. Applying cosmetic and lip balm, changing contact lens, and using the toilets. Also before and after all activities that entail hand contact with mucous membranes, eyes, and breaks in skin, macam wound. Okay. Handling sharp needles and sharp object contaminated with blood and other potentially infectious materials should not be manipulated in any way, including resheath. Maknanya dia asalnya dalam ada cap, you unsheath, you buka, you don't need to resheath the needle. Okay, dia macam itu you buang. No need to resheath because that increase the risk of getting sharp injury. You do not bend it, you do not clip it, you do not try to remove the syringe from the needle from the syringe. Okay. Resheathing and recapping is only permitted when there are no other alternatives or when recapping is required by specific medical procedures. Okay. One-handed or a resheathing device is often used in those situations. Documentation in the exposure control plan should be able to identify the specific procedure by which resheathing is permitted. Okay. Sharps. What are the sharps that we could find in our lab? It could be needles, it could be blades, pipettes, glass pipettes that are broken, syringes with needles, glass slide. Nanti nak buat smear, we break some of the slides, bukan glass slide and glass slides. Then it is considered a sharp. If they are contaminated, we have used it for and already exposed to samples. This must be placed in a puncture-resistant container. The container, the red and the yellow container, to sharp bin container, they are made from puncture-resistant material, and they have been properly labeled with universal biohazard symbol. Okay. Okay. So we have a lot of different type of this bin. Normally they are red or yellow. This one is foot pedal cut with hinged lid. Quite sophisticated. So dia dekat atas floor lah. And then we just use our foot to open the lid. In-room system wall enclosure. So this one is put on the wall. Multi-purpose container with horizontal drop lid on the bench. Phlebotomy containers, usually smaller in size because the phlebotomy, so the nurse need to go around, so they may want to carry, so we created something which is easy for them, convenient to be carried around. Okay. Sample handling. When checking for clots, filling hydrocytometer chambers, making slides, discarding specimen, making dilutions, when pouring specimen of weight, you may be handling these samples. So they must be performed in such a way that splashing, spraying, or production of droplets is prevented. You can use plastic shield, okay, or use protective eyewear. Ini contoh ni a few years ago when I show this, people might find that this is a bit extreme. Nak pakai sampai apa, shield, face shield macam ni kan. But today is becoming a norm, yeah, especially after COVID-19 ni. People even wear things like this on the street, yeah, in the shop, in restaurant, they wear this kind of mask. Okay, you can also not wearing a mask but have a glass like this, and you work from behind the glass. Okay, this is how we take off our gloves. Yeah, the aim is you want to wear a glove to protect your skin. You want to wear a glove to protect your skin. So if you look at A itu the first step. Yeah, you grab the glove at the wrist area, and then you take it off, and in the other hand you make it into a ball. Yeah, you hold it in the palm. Okay, using your already free hand, you put your fingers inside the glove and push. So the glove, the side of the glove that it has been used will not touch your skin. Okay, we will show this again in the lab. Okay, this is the last slide. Okay, I'm sure you are all dying to go now because today's lecture is somewhat dry. Yeah? Something that you have heard before perhaps. Every sample in any biomed labs, especially in hemato and immuno labs, are potentially hazardous. In fact, we treat all sample as hazardous. Tak kisahlah kita tahu dia HIV ke tidak ke, we treat all samples as hazardous. And then steps are to be taken in the management of lab procedures and safety, recognizing hazards. We must know what is hazard, what are the definitions. We must know what are the potential errors, and we must know that preventing the unfortunate events is possible as long as we follow SOP. We take care, we put attention to details. Yeah, and the lecture of today is part of this. Yeah, part of your training. You have many of these kind of lecture again and again throughout your career. Okay, any question? Rauda, are you there?
Yes, I have no question yet.
You have no question? I have a question for you. Can I ask you?
Yes.
Boleh. Okay. Give. Tapi tak ada markah lah Rauda. Kalau jawab betul pun tak ada markah lah. Ini setakat ni je. Give me two type of infections that someone working in a hemato lab may be exposed to.
Two type of infection.
That someone working in a hemato lab may be exposed to.
With the penyakit HIV, HPV from the sample.
From the sample. Excellent. HIV, apa tadi satu?
HPV.
HPV, hepatitis B. Ya. Okay. Haizatul Umiyah ni. Are you there?
Hello?
Are you there? Okay.
Yes, yes.
Okay. If you remember, I mentioned that an effective hand sanitizer must have a certain quantity of alcohol in it.
Yes.
Okay. Berapa persen?
Minimum 60 berapa Tapi paling bagus 70% ke atas lah.
70% and over.
70%.
Okay. Awak ada hand sanitizer sendiri?
Ada doktor.
Ada. Berapa persen?
Itano 70%.
70% bagus. Awak beli dari mana?
Saya ambil ayah saya punya doktor.
Apa dia?
Saya ambil ayah saya punya doktor.
Ayah awak punya awak. Ya, brand apa tu?
Seni Scrub E.
Oh, okay. Nama yang okay lah Okay. Alright. You got any question?
No doktor.
Okay. So that's all. I hope everyone has already clicked on the attendant link and sign in. Okay. If you have not done so, I've set it so that it is still available until next week. Tak ada excuse not to sign in. Yeah. Okay. Thank you very much for your time. Anything you can ask me through WhatsApp or through email. Okay, wassalamualaikum warahmatullahi wabarakatuh. Walhamdulillahirabbil alamin.